Okay. Hello, Mendocino County. I am filming this statement here in front of our county offices, and I've taken off my facial covering because I'm more than 6 feet away from my good colleagues here, and we're outside. There's a good breeze flowing, so it's safe for me to take this off, and I think it'd be hard for you to understand me if I was speaking with a mask. But just to let you know that even your health officer is wearing a facial covering in public. So I do have some notes here. I'm not going to read them all, but I'm going to refer to them because there's some points I want to be sure to cover today. First of all, today is June 3rd. It becomes a blur when we've been responding to this event for so many months on end. Today is June 3rd, it's Wednesday, and as of today, we have 33 cases of COVID in Mendocino County. We had 5 new cases announced today, and that came from our OptumServe testing site. So Mendocino County, OptumServe is so important for us. If we're going to keep moving forward with limited reopening, we need to have increased testing capacity. And OptumServe has been provided to us by the state. It costs the county nothing because the state pays for this resource. So when we're having to really monitor our budget and be very, very careful about our resources for Mendocino County, this OptumServe is an incredible gift to us from the state. And so I encourage all of Mendocino County to come for testing in Ukiah at OptumServe, and we'll share that information for you. It's at the fairgrounds. And additionally, we are doing surveillance testing for individuals that can't come to the OptumServe around our county, who might be in skilled nursing facilities or might live far away from Ukiah. We have a process in place to get samples from these individuals and bring them to our OptumServe collection site. So this resource, while it is based in Mendocino County, is for all of Mendocino County. So more and more as we move forward, you're going to be hearing us talking about OptumServe, and this resource is for surveillance testing. This is for people who are not sick, but we want to make sure that we continuously sample our community, our population, to make sure we don't have cases of COVID hiding. And in fact, we had 5 cases emerge from our OptumServe testing that we've done thus far. So clearly this is helping for us to uncover those cases that we weren't aware of in our community. These individuals at this time are close contacts of prior cases that we knew about. As we do the case investigation, contact tracing, this is what's become clear, and they are in home quarantine if they're a close contact, or in isolation if they're a case. And we monitor daily these individuals from public health, and that's what we've been doing for months now. So in terms of our status as a county, we have 33 cases this far. We've had a total of 4 hospitalizations. All of the hospitalizations have improved thanks to the great care that they've been provided in our Adventist hospital, and we just have 1 individual remaining in the hospital. So we're doing very well as a county. However, that's a lot of cases for us. Even 33 is a lot. So as we want to move forward into limited reopening, we have to be very, very careful that we don't have larger outbreaks and more people becoming sick all at once in our county. And that's what I want to talk about today, is limited reopening. So with limited reopening, what we do is a process that we already started several weeks ago, where we did an attestation to the state. And in that attestation, we asked for a variance allowance to open up further into what we call stage 2.5. Through that process, we were very fortunate and very grateful that we were allowed and supported by the state to open up retail for in-store shopping, to open up restaurants for in-restaurant dining, with certain restrictions, of course, to prevent the spread of COVID. Since we achieved attestation, we had further reopening with the allowance for gatherings in places of worship, gatherings for funerals, and gatherings for protests. These all came out in my last sheltering in place orders. So as we're moving further into our need to continue a limited reopening, I'm going to be addressing the need to try and open other businesses, and this is going to be through a process of attestation again with the state. So I'm going to refer to my notes now that of course, as we do limited reopening, the health of our county is of utmost importance. So we are constantly monitoring the health conditions in our county, those people who've recovered from COVID, those might still be in isolation, and so on. But additionally, we have some other concerns. For example, This week we've had protests, and that has caused mass gatherings to occur. And this is our right to have safe and peaceful protests. But as people come out for these protests, we are observing that there is some crowding, there are people coming into close contact. But we also have been observing in Mendocino County that people have been wearing their facial coverings. These gatherings have been very peaceful, and they have been spacing themselves. So I'm hopeful that the peaceful protests that we've had in Mendocino County won't lead to any outbreaks. But due to all of this activity that we've been having, more gatherings, people coming together for faith-based services, people coming together for their constitutional rights to protest, we may have more cases. So as we monitor this closely in the attestation and variance process, our team will be putting together a report for the state. And that report is going to ask for the ability to do a number of further limited reopenings. One will be a possible further expansion of shared pools for more local use, for people living within our counties to use shared pools. For example, we already have shared pools allowed for childcare and for children's extracurricular activities, but we also are allowing them for physical therapy with a physician's or a clinician's referral. So we're going to see if we can get more opening of pools, because it's such an important part of our well-being to get people to allow them to safely recreate in pools. Also, I'm going to include in this next variance the attempt to see if we can get public and private campgrounds opened up for limited use. Furthermore, lodging for broader uses than currently allowed, if sufficiently safe measures can be implemented. Furthermore, while salons and barbershops can open per the current sheltering in place orders for haircuts, hair treatments and braiding and so on, essentially treatments for the hair, I would like to open further activity in salons, such as for nails. But this particular nail salons and related personal service salons, the governor has signaled this may require involvement of state legislature. So I don't know what we're going to be able to do for salons to allow for more opening than the hair, but we are going to inquire. And then finally, childcare and day camps are open per the current sheltering in place order for childcare units and children's extracurricular units. And I'm anticipating further state guidance, hopefully this week, to allow schools and summer camps to have further reopening. So the theme here is that we want to work closely with the governor and with the state to make sure that we both open as much as safe for our county, but also that we follow what is allowed by the governor. And we will be putting forward this attestation next week, so that my goal is to write new sheltering in place orders that allow further limited reopening on June 12th. So I do want to share very openly that we are in the process of this limited reopening further steps, but to also caution that we are asking for permission, we are asking for support from the state, and until we get a final decision, we are still in that process. So it is work in progress. But our team here at the county is working very hard with me to put this variance request forward in a very strong way, and this will include our data that shows that we are doing a good job in Mendocino County of flattening the curve, slowing the spread, and containing this disease. The progression that we've had through stage 2.5 with our last attestation has gone well. And a big part of that opening was the testing, and continues to be the testing. So our goal is to do 135 tests a day. And as I mentioned, OptumServe is critical for us to be able to reach that goal. Other ways that people can still be tested in our county, OptumServe is for surveillance testing. Individuals who are sick should continue to call ahead to their clinics and to the hospital if they're able. And when they go for the care, if the clinician who evaluates them, these sick individuals, believes that a COVID test is a good idea, it will be done in the hospital or in the clinic, and that is through the resources that the clinics and hospitals have to directly order tests and do tests. The hospital has testing capacity in the hospital, and some of our clinics have testing capacity in the clinics. So that remains a very good way to get care if you're sick, and to also get tested is to call ahead if you can, go to the clinics and hospitals, and they will test you there if indicated. I have mentioned earlier in this week that the use of this machine called an Abbott ID Now. This is not for surveillance testing. Some of the clinics and hospitals have this machine. This is for people who have symptoms where the clinician who is checking on them has a high degree of suspicion that this is a person who may have symptomatic COVID. So this remains a very good testing resource for people that are symptomatic, but not for surveillance testing. For surveillance testing, we have OptumServe. The other resource that we have, if we have an outbreak, if we have a case, we do case investigation, contact tracing, and we're concerned that that case has led to spread into a population, that's when we do our outbreak testing. That was with our county staff, and that testing goes to the Sonoma County lab in Santa Rosa or to the state lab in Richmond, California. And our staff will courier those samples to those facilities. That's for outbreak testing. So we have testing if people are sick, they go to their clinicians. If they are having surveillance, they should go to OptumServe. And then if they are in an outbreak situation, public health would be contacting them, and we would do our outbreak testing through our public health labs in Sonoma County and Richmond. So as we move forward with this pandemic, I just want to thank all of our many partners, which are our clinics, our clinical partners, the hospitals, our faith-based groups, our board of supervisors, our elected officials, our city managers and leadership, all of the individuals, our community members who are working so hard together to contain this pandemic. It's very hard. I know we're all tired. It's the heat of summer, and we also are having, protests around our country. But I'm so proud of Mendocino County, how we've worked together, we've pulled together, and I'm so grateful for my team here at the county that has done such a great job from the very, very beginning to respond to this pandemic. So thank you, and I'm honored to be your health officer, and I will continue to serve as long as I am asked to. Thank you very much.